Now, the Blue Dog Coalition represents largely rural Democratic districts, and I know you want to see Medicare reimbursement rates either rise or stay the same for some of the small hospitals and medical providers in those areas. I get that, because if the funding gets cut, they close their doors. At the same time, you're arguing for cuts in Medicare reimbursement rates to contain costs. To some, that's a pretty contradictory message. I want to give you an opportunity to explain and defend yourself against that criticism.
Yeah, I'll be glad. I appreciate the opportunity. I can assure you that the few provisions in the healthcare reform bill that we actually want to increase cost on are going to be more than offset with the number of proposals that we have on containing cost. Here, this is when I talk about Medicare provider rates. It's not about the doctors. It is somewhat about the hospitals, and I represent 29 counties, 150 towns, and in most of my rural counties, the hospital and healthcare in general is either the first or second largest employer in that area. So it also has an economic impact on a local community. But it really boils down to this. We have what's called regional disparities in how Medicare providers are reimbursed. And typically it's the rural areas that get squeezed the most. And yet in today's atmosphere, the only difference between a doctor in a big city and a doctor in a small town is the fact they've got fewer people to run through those very expensive machines that are pretty much required even in doctors' offices and in hospitals in small towns these days. So somewhere along the way, the formula got messed up many years ago based on what it costs to live in a small town versus a big town. But that $200,000 x-ray machine or this $300,000 piece of equipment that doctors are required to have to practice medicine today, it has to be in that office whether they're in a small town or large town. The only difference is you're running fewer people through it in a small town. So here's what it's really about, though. Because providers are reimbursed at such a low level, as much as 30% below private insurance companies, there's more and more of them saying, and I know you've probably seen it before, you can just go from doctor's office to doctor's office and you'll see a number of them that have a sign in the window that says, we no longer accept new Medicare patients. Well, let's think about this. If a public option is based on Medicare rates, and we're going to use the Medicare providers as the new network of doctors to see those who sign up for this public option, then how long would the wait be for them? I know there's places in my district now where you have to wait 3 months if you're on Medicare to find a doctor that will see you if you're trying to enter into a new doctor-patient relationship. So you add tens of millions of more people to that. How long is the wait going to be? 3 months, 6 months, 12 months? So, I mean, it's easy to provide people with a shiny new insurance card, but if it doesn't get them in to see a doctor, then we really haven't accomplished anything. The second part of this is the private insurance industry has been subsidizing our government and subsidizing our hospitals because they do pay 20 to 30% more than Medicare. Now, if we have a public option where non-seniors, the seniors a little bit different because the private insurance industry is not competing for their business. They're all on Medicare. But you take non-seniors and you put them into the equation on a public option that includes Medicare rates, Medicare providers, and you ask the private insurance companies to compete with that, what are they going to have to do? They're going to have to cut their rates to the Medicare rate in order to be competitive with the public plan option. And when they do that, it's going to literally bankrupt and shut the doors of a number of rural hospitals. So that's why that's a big issue to us and one that we want to get addressed.
So what are the consequences, do you think, of no legislation passing? What do you think the political repercussions will be if nothing is done on health care reform?
I think something will be done. What we're saying is, why does it have to be done by August 1? Why rush it? I was one of 20-something members of Congress invited by President Obama to the White House back in March when he hosted a White House National Healthcare Summit to announce that this was going to be a top priority for him in his first year in office. And he said then that he wanted to get healthcare reform done this year. Somewhere along the way, everyone started talking about getting it done before August 1, before the August congressional recess, where we're all back home in our districts getting out and seeing the people. The Senate has now decided they're going to bring a bill to the floor sometime after we return in September, and President Obama says that's okay if we bring it up and consider it in the fall. And so, our deal is let's not rush this. It's very complex. It's about 1,250 pages in length at this time. Let's slow down. Let's make sure there's no unintended consequences in this, and that we get it right. And let's give members of Congress and the American people an opportunity to read the bill and fully understand it. And that's important for another reason, too, because there's a lot of misinformation. A lot of people think they're going to be forced into some government-run health care plan. If this bill passes, I can promise you three things. If there is a public option plan, everyone in this country will have the freedom to choose it. It will compete alongside private insurance plans. It'll be your freedom to choose which plan you want. I can also promise you that if we pass the health care reform bill this year, if you have health insurance today, if you're one of the fortunate ones that do, and you like what you got, you'll be able to keep it, and you'll always be able to choose your own doctor. So there's a lot of misinformation out there. I mean, it's my understanding I've kind of found myself in the eye of this storm, if you will, and it's my understanding that as a result of that, there's over $1 million by special interest lobbyists, special interest groups being spent in Arkansas right now on radio and TV and direct mail, trying to tell the voters to call me and tell me how to vote on this thing. I mean, that right there tells you that there's a lot of waste in the current system. And there's a lot of people currently involved with the current system that are making a whole lot of money, and they don't want that to change. If I could get back to why the inflation issue is so important and why cost containment is so important, it's this. A lot of people think that this debate is simply about the 48 million that do not have health insurance today, and certainly that's an important part of it. And we want to have health insurance that's affordable for those people because, as I said earlier, we're paying for them anyway, plus it's the right thing to do. But on average, $1,000 a year that you pay for health insurance has nothing to do with your care. It's going to cover the uninsured, those that show up in the hospitals and the emergency rooms. But here's why it's important to those who are fortunate enough to have health insurance today. Health insurance costs are growing, or I should say health care costs. Health care costs are growing at twice the rate of inflation. That's unsustainable for our government, and it's unsustainable for the American people. I know a lot of people get worked up when you talk about national health care. But the reality is half the people in America already have national health care. It's called Medicare, Medicaid, Our Kids First, veterans and military retiree health care. And when you combine those already existing national health care plans with Social Security, that consumes 40 cents out of every tax dollar today. If health care costs continue to grow at twice the rate of inflation, that's going to consume 100% of all federal revenue by 2040. That means we'll no longer have an Army or an Air Force or Department of Education or Department of Agriculture, Department of Defense. Obviously, as a nation, we cannot afford to let that happen. So we can never balance the federal budget again until we get these health care costs under control. That's why cost containment is so important to us as a government. Now let me tell you why it's so important to the American people. It's going to reach a point in the next 10 to 15 years where neither the employer nor the employee can afford the high cost of health insurance. Employers that are providing health insurance today, the cost for that health insurance is rising about 4 times faster than wages. We have seen wages not grow very much in the last 2 decades. The reason for that, the employer is being required to take more and more of your pay raise and put it into the part that they pay of your health insurance. A lot of times all we think about when we see health insurance on our pay stub, we only think about the part we pay. A lot of times we don't think about the part the employer pays. On average in this country, the employer is paying 85% of the cost. So when you see that whether it's $100 a month or $400 a month being held out of your paycheck for health insurance, that's a small fraction of what your employer, for those of you fortunate enough to have an employer-based system, is actually paying. So we're already seeing more of the shifting of the cost. We're already seeing more and more employers shifting more and more of the cost of health care from the employer to the employee. And it's going to reach a point in the next 10 to 15 years where neither one of them can afford it. And that's why this debate is so important. And health care reform, fundamental healthcare reform is so important for all of us.